Hello everyone, good afternoon everybody. I'm Priyanjali from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today, let's dive into a topic that affects a lot of people but often doesn't get enough attention. Hair related disorders. Whether it's hair thinning, dandruff or conditions like alopecia, these issues can have big impact on both your physical health and emotional well-being. And just like a fungal infection, the earlier we take action, the better the results are. Hair disorders can range from mild to severe, affecting people of all ages and backgrounds. Things like stress, hormonal changes, poor diet, or even emotional factors can contribute to hair problems. Some of the most common conditions include hair loss, both temporary and permanent, dandruff, and scalp infections, which can cause discomfort, itching, and even embarrassment. But here's the good news, just like with any health issue, awareness and early intervention are key. We can take steps to prevent hair disorders before they start or at least minimize their impact. By understanding the causes, adopting healthy habits, and using the right treatments, we can protect our hair and maintain its health for the long term. Let's focus on how we can prevent hair related disorders, recognize the signs early, and explore the latest treatments and solutions that can help restore and maintain our hair health. Whether it's better scalp care, nutritional improvement, or seeking professional advice, we always have the power to care for our health, hair, and keep looking its best. So let's connect today with our skin expert, Dr. Vignesh Narayan R. Is a MD DNB Fellowship in Dermatosurgery and Dermatology, Bangalore Medical College and Research Institute, MBBS JIPMER Puducherry, MD Dermatology, Venereology, and Leprology, PGIMR Chandigarh, ex senior resident, MS Ramaiah Medical College, Bangalore, 2023, BCBR qualified. And Dr. Vignesh Narayan is a very highly fied, experienced professional with distinguished background in dermatology, with extensive expertise in clinical dermatology. He brings a wealth of knowledge to his practice. And today we are here with him on the screen. I would like to welcome you to today's screen, Doctor. Well, let's start with the most basic questions, which are which hair disorders are commonly seen in practice? The normal hair disorders which are seen.
Right. Thank you so much for the wonderful invitation, and it's a pleasure to be here, to be among this forum and discussing common and relevant topics that matter to everyone. So, as far as the first question is concerned, well, hair loss per se is very common, and it affects a large majority of the people. In fact, around 30% of the people around you are suffering from some form of the hair loss or the other. And if we see, the most common pattern among them is the patterned hair loss, and that is divided into two types, male pattern and female pattern hair loss, which affect men and women respectively. Other than that, of course, there are other common conditions also, like telogen effluvium, which occurs after stress, and we have tractional alopecia, which occurs after practices such as wearing hairs tightly. And also we have few autoimmune conditions as well that are quite common, such as alopecia areata. So these are the
Mm,
common conditions which affect people that we see around us.
right, right. Now, doctor, I think that today when we talk about hair loss, every single person is suffering. And people nowadays they have given up, caring about their hair because there are alternatives available just to hide. Maybe it's I think it's mainly the emotional health which is being hampered, mainly majorly when we are talking about hair related problems, that we are not able to face the crowd, we are not able to face people. But there are alternatives nowadays. There are extensions, there are scalp adjustments and such sort of things. But for all the people who have lost hope at this point of time that this is not going to come again, and no matter how much we try, we cannot get our hair back, what do we have to say for them? I would like to ask this in the initial stage of today's life, because I would want people to have a ray of hope, while they are watching this live. So what do you have to say for that?
Well, I have to say that hair loss is more than just skin, right? So it affects the way a person perceives
Right.
himself and how he or she feels the world around them perceive them. So it's more emotional rather than just a physical thing. So it's definitely something that needs to
I
be
agree.
addressed. Yeah, and I wish to tell you that there are most of the conditions that we do have can be treated, especially like this male pattern and female pattern hair loss, which affects the majority of the people. They can be controlled, so the
Right.
rate of progress can be controlled to a great extent. It can be slowed down to a great extent. And of course, there are always new modalities of treatment that are coming up that can help to, slow down the rate of progress. And in certain conditions
Mm-hmm.
like alopecia areata, even though they do come and go time and again, when they do come, there are a number of effective treatment options available and new ones that are definitely coming up. So, what is required here is a holistic and supportive approach that includes both
Mm-hmm.
medical, non-medical therapy, and nutritional and lifestyle factors as well. In fact, there are a number of supportive groups out there for people with these conditions, and it would help you to talk with your healthcare provider and also with like-minded people who are having similar conditions. Maybe that can help to alleviate the some of the psychological burden that the condition is having. And the good thing is, few of the conditions like tractional alopecia can be solved with a simple change, like changing how you tie your hair. And telogen effluvium is a completely reversible condition. So yeah, there is always a ray of hope.
Right, right. Well, I would like to move ahead with the next question, doctor. We are talking about the male pattern and the female pattern hair loss. So, which age group is more susceptible to be seen with this condition?
So pattern hair loss begins quite early. In fact, it begins in men in the 20s and the 30s. And the rate at which it occurs or the age at which it occurs varies according to the different races that are available. And it occurs more earlier in Europeans and the Southeast Asian population, but it does occur to a great extent in our Indian population as well. You could typically take it around the 20 to 30 years of age range. In fact, around 30% of men at the age of 30 and 50 by the age of 50 have this male pattern hair loss. For women, it usually begins later on, maybe in the late 30s and around the menopause. So that is when you notice it in women. So that being said, it does begin quite early. So it's a good thing to start the treatment early.
Right, right. Now, moving ahead, doctor, I would want to ask one of the most general question which we usually tend to miss out on. There are people with conceptions that by using products or by visiting a doctor maybe without any I'm not talking about such transplants or such PRP treatments here, but just by taking medicines or maybe applying something or maybe home remedies, they can have abnormal hair growth like the growth we see people with, you know there are people with such genes who have really good hair. So we somehow think by using products and using medicines we can have such hair growth. Tell us, doctor, is it possible for any
Well,
person to, you know,
yeah.
achieve
So
that?
right, right. So it depends on what condition we're talking about, and I presume that we're talking about the pattern hair loss, which is most commonly seen.
Right,
Right.
right.
Yeah. In this condition, right, the to a great extent, it really relies on medical therapy and treatment modalities. Although the home remedies and nutrition does play a role, but not so much
Right.
in this type of hair loss. Where it does play a great role is something called telogen effluvium, in which the nutritional aspect and stress aspect play a much more greater role in the disease causation per se. But that being said, even in these cases of pattern hair loss, you do have to follow a good diet. You can try to reduce the
Mm,
amount of stress. Even in conditions like alopecia areata, which are autoimmune mediated, stress plays a major role in the pathogenesis of this. So this is where the
right,
lifestyle plays a great role. And in fact,
right.
it's quite confusing for some people to follow a structured plan. I've actually created a structured PDF format which people can download from
Hmm.
my Instagram bio regarding the lifestyle and dietary changes that they can follow for
Right,
managing us by themselves as well. But that being said, that is definitely an adjuvant to the medical treatment and may not be as a standalone.
right, right. Now, I think everybody should keep this in mind when we are talking about hair loss or any skin issue, maybe that these are the basic things we tend to miss on, the basic routine, the basic lifestyle. So yeah, along with the medication, as doctor already mentioned, uh, the kind of lifestyle, doctor, you said that we can visit your Instagram page and uh, but can you give us a slight hint like the kind of lifestyle
Right.
one should generally um, you know
Sure. So if you look at hair, hair is like any other organ of the body. So it's made of protein, right? So you need to consume protein-rich foods so that you can form keratin, which is actually the protein that makes up the hair shaft. In addition to that, you require a few nutrients that are required for cementing these proteins together. Especially vitamin C plays a major role, and few other micronutrients as well, such as biotin and zinc. So, and also you require omega-3 fatty acids, because what this omega-3 fatty acid does is it is required for coating the hair shafts properly and for forming a cuticle so that the hair doesn't get damaged. So
Mm.
basically, from a ballpark, if you want a diet plan that you can follow right out at the outset, I would say you can consume 1 glass of lemon juice every day prior to your breakfast.
Right.
You can
Right.
consume around 15 pumpkin seeds in the evening, and if you are a
Mm.
vegetarian, you can consume pulses every day, and so you take some amount of protein. And if you
Right.
do eat eggs or non-veg, you can consume one boiled egg per day. So that would be a ballpark thing that anyone can follow right at the outset for their hair. And
Right.
as far rest part is concerned, maybe you can try something called box breathing. You know, where you inhale for 4 seconds, hold it for 4 seconds, and then exhale for 4 seconds, and then you repeat the pattern. What this does is it sort of re-engineers your sympathetic nervous system, the part of your brain that controls the stress. So when you do that for at least 2 to 3 minutes a day, you can control the amount of stress hormones that your body is producing, and thereby reduce the amount of stress that you're having. And also,
Right.
one thing that people do wrong is they use a lot of these heat devices. You know, they use a hair dryer, they use their hair straighteners for a long period of time. That sort of
Mm.
denatures the hair shaft and causes the hair fall. So you avoid traumatic practices like using a hot iron or using a blow dryer at high temperatures. Also, what you should avoid is avoid scrubbing your hair when it's wet, and avoid combing it when it's wet. Allow it to dry, because once it's dry, the chances of the cuticle getting damaged are less.
Right. Well, I think all the suggestions, all the informations that we just received will be really, really helpful for all of us, doctor. Um, well, that's about the diet. But tell us, doctor, does sleep pattern also somehow play any role in this?
Yeah, sleep plays a role, because you need to get at least 7 hours of sleep. Because when you get less than that, your body starts producing more of cortisol. So cortisol is basically a stress hormone that sends a danger signal to your body. And whenever your body is under stress, it tries to take away nutrients from hair and shifts it to the more essential parts of your body. So your hair ends up getting a lesser amount of nutrients required for growth. So at least 7 hours of uninterrupted sleep is required.
Right, right. Well, we are talking about the 7 hours of sleep, but does that mean that one can sleep? Because nowadays, when we are talking about today's generation, they have a habit of staying awake late night. Probably they do not get up in the morning. This is what the routine is, and they will get up probably at the noon, and then they starts after that. Especially after the COVID period, we see when work from home is now. We are also working from home at this point of time, doctor. Yeah. So we see these patterns nowadays. Is it also causing hair fall somehow?
Right. So, because what happens when you do that is you stay awake late in the night, you are using these gadgets and artificial light sources. So, that's emitting a lot of blue light. And blue light is actually disturbing your circadian rhythm, and it's circadian rhythm in the sense the day to day biological clock, if you would have it. So, it's altering that. And it's sort of, putting your body in a stressful state. Because even if you try to sleep in the morning, your body was not designed to be doing that, but you're sort of forcing it to do that. So in the end, you're not getting good quality sleep. So in the end, that's going to affect your hair as well. So my rule of the thumb is avoid any blue light or gadgets. At least 2 to 3 hours prior to your bed, and I would recommend not going for it beyond 12 p.m. 12 a.m. Right. So that is something that you can
Right.
follow at the outright.
Right. Let's also talk about few of the external damages that can cause hair loss. Doctor,
Right.
we have heard that the pillowcase that we sleep in, let's start with the basic things only. The pillowcase we sleep in. Should we have to be particular regarding the pillowcases? Does it have to be like a particular material or something like that?
It would help if it's of a particular material, because the pillowcase you sleep on is the thing that's rubbing your hair for 8 hours in a day, every day, right? So it would help if you have some soft fabric, like cotton or silk and bamboo fiber. These stuff allow it to aerate, and they are soft on your hair. So it
Right.
sort of reduces the friction damage that occurs. In addition, I would
Right.
recommend washing them at least once in 3 days because they can be a storehouse of bacteria, and they can lead to
Mm,
infections. So yeah, so you need to
right.
wash them 3 days, and not only your hair, your skin will also thank you when you start doing that.
Right, right. Well, doctor, what about the water that we require to wash our hair with? Nowadays, mostly we see the iron content in everywhere, in all the places. In waters, it's huge, it's humongous. The place where I am staying, the water, it blocks every 15-20 days. It's everywhere, even after having a filter. So
Right.
how do we deal with it, the situation? And does water also play an important role in hair loss?
Yes, water does play a role. So what you can do is, if you can change your water source, it's well and good. But if that is not possible, what you can do is you need to use a good shampoo. A good shampoo which
Mhm,
can neutralize the hardness of the water and sort of remove all the salts that are there. And also, what I would
mhm,
recommend is to use a good conditioner post your wash, because what the conditioner does is it sort of repairs some of the damage that has been done by the hard water, and it also gives a coating on your hair shaft so that it prevents further
right,
damage. So that is one thing, and another thing that is very important for hair is hydration, because hair, as you know, it would also be requiring some amount of water. So you need to take adequate amount of hydration as well, so your hair shafts are being formed properly. Because your scalp health
right,
also matters. Hair is basically developing from the scalp, so you need to hydrate it well enough.
right, right. Moving ahead, doctor. Uh, Tell us, can medications also somehow, cause hair loss, over-the-counter medications?
So medications are, over-the-counter medications. Sometimes they don't work in the way they are intended to. Some of them can cause
Mm,
an irritation reaction because they are sort of irritating the scalp. And some of them claim that by doing the irritation, they're going to stimulate your hair growth. But in the end, you may end up damaging your hair follicles. So that's a thing that you need to
mm,
look out with over-the-counter medications. When you come to medical therapy per
mm,
se, they may produce a hair loss in the initial stages, because what happens is hair grows like in a cyclical manner. So there's a growth
mm,
phase, there's a stationary phase, and there's a shedding phase. So whenever you use these medications, that even what we prescribe, sometimes the weak hairs that are there fall off, because only when the weak
mm,
hairs start shedding, the growing hairs can take their place. So in that
right,
scenario, right, but you should not use any over-the-counter products that might actually damage your hair. But when you do use certain medical products, they may initially cause a period of shedding, but that will eventually recover with stronger and thicker hair.
right, right. Well, this was a very important information. Doctor, when we are talking about hair fall or hair loss, as you said, the weaker hairs we called out, how many
Right.
hair a day is normal? Like, how many hair, like, falling off, how many hair can be a normal thing for a day?
Right. So the space is finite on your scalp. So old and weak hair needs to fall for new ones to come. So a rule of the thumb is around 100 hairs per day is the normal number. So if you're losing around 100 hairs per day, I don't think you should be worried about that, because that's the normal shedding. Only when it goes above that would you need to be concerned.
Right, right. Well, let's dive into the diagnosis part now. What if the patient comes with few of such uh, symptoms that we are talking about?
Right.
And what is the first step that we take in, the kind of treatments which are currently available? Bit about that, doctor.
All right. So, diagnosing hair loss involves a structured approach of both the clinical history, evaluation, and certain times diagnostic tests like a dermoscopy, and sometimes scalp biopsy may also be required to diagnose the condition. So, as a ballpark, I'll just give you an idea. So, usually when you have this receding of the hairline and widening of the frontotemporal angles, which is the angle that is
Mm,
formed between the front and the side of the hair, and it is a
mm,
chronic and process, that is indicative of your pattern hair loss or male pattern baldness. Women sort of
right.
have a widening of the central partition when we talk about female pattern hair loss. And in tractional alopecia, you sort of have receding of the hairline, and often there is history of tightly tying the hair. Alopecia areata, on the other hand, sort of presents with sudden onset patchy loss of hair in a well-defined circular manner. So that would point towards
Mm,
that. Of course, there are certain tricky situations in which alopecia areata may mimic pattern hair loss. In those situations, we have to go for certain tests like dermoscopy and sometimes a scalp biopsy. So that being said,
mm,
whenever you're facing a hair loss, you need to visit a qualified dermatologist so that you can get it diagnosed and treated accurately. And as far as the treatments are concerned, it depends on what we're dealing with. And if you're talking about the pattern hair loss, there are a number of medications that are currently available. If you look
Right.
at the root cause of this patterned hair loss, it's because of a
Mm-hmm.
hormone called DHT or dihydrotestosterone in men. Some men are
Mm-hmm.
overly sensitive to the hormone, so that's why they have this thinning of the hair that is caused by the DHT. So the therapy typically involves blocking this DHT, which may be done with the help of tablets such as finasteride. And also there is something called minoxidil, which helps to increase the hair growth by promoting the blood flow to the scalp. So those are the two common therapies that are there. And of course, newer procedures are also are being done for the hair loss. There are a number of injectable therapies that are available for hair loss, such as PRP, GFC, exosome, your autologous mesenchymal therapy, and autologous fat therapy. And certain studies have also shown that botulinum toxin injection or Botox can actually work for hair loss as well. So how all of these treatment work is they are going to go and stimulate the dormant hair follicles or the sleeping hair follicles, and it's going to stimulate them to grow. So because they are working in that manner, they usually take some little bit more time to show the results compared to the other modes of therapy. So I would say you need to wait for around maybe 6 months or 3 to 6 months to see the results of these injectable therapies as compared to the minoxidil and the finasteride, which may show you a faster result. And let's go
Right.
to the other topic was, of course, alopecia areata, which is an autoimmune hair loss condition. In this condition, what happens is the immune system is going haywire and it's attacking your normal hair follicles and is causing the hair fall. So, what we need to do over here is we need to control the overactive immunity. And traditional modes of therapy of this includes corticosteroids, right? So, the corticosteroids can be either in the form of creams, it can be in the form of injections, it can be in the form of tablets. All of them work the same way. And of course, we have a number of new developments that are coming in for the treatment of this alopecia areata. One of them is a molecule called tofacitinib. So how it works is it's going to reduce the amount of inflammation that is going on and thereby reduce the autoimmunity. And of course, we have other modalities of treatment like contact sensitization as well. So what we do in contact sensitization and contact immunotherapy is we sort of confuse the overactive immune system into causing an allergic reaction rather than causing a hair fall. So that is the new. Those are the therapies of treatment for alopecia areata. And of course, telogen effluvium can be managed by treating the underlying cause, which of the most times is usually a nutritional deficiency. And of course, fractional alopecia can be treated by adopting a looser hairstyle.
Right. Well, that was a lot of information to take in. Doctor, let's go one by one. Okay.
Sure.
We know that the kind of products you mentioned, the kind of treatments that you mentioned, among these, initially minoxidil, as you mentioned, it's one of the most hyped product in the market right now. Probably a lot of companies, a lot of brands are selling it. What is the right way to use it? In case if anybody is planning to, and is it a combination medicine? Do they need to combine it with some any other products? And uh, you were talking about the male pattern hair loss. Does it also work for the female pattern hair loss?
Right. Even though we term it as male and female pattern hair loss, both of them are usually due to androgens or the male hormones which are in excess, right?
i'm
And
sorry i'm
minoxidil,
sorry to interrupt, doctor. We are not able to hear you. You are not
yeah.
audible to us.
Just a second. Is my video still coming right? Can you hear me now?
we can, we can hear you now. Yes.
Yeah. Yeah. Like I said, even though we use the term male and female pattern hair loss, the underlying pathogenesis is basically the same, right? So it's a male hormone which is in excess that's causing the hair fall and the hair loss. So minoxidil does work in both of them because it's going to increase the blood flow to the scalp and it's going to stimulate the hair growth. Right. So minoxidil can be used by women as well, and the way it works is by opening the potassium channel. And the thing about minoxidil is it has to be used in a consistent manner in order to see the results. Because we are not
Mm,
treating the underlying cause that is causing the hair loss, we are sort of halting the progress. So as long
mm,
as you keep using the minoxidil, it's going to keep halting the progress. And once you stop using it, you're just letting go of the brakes that are there, and it's going to resume in the original pattern that it was meant to progress at. So that being said, so minoxidil is available both in the form of lotions and in the form of tablets as well. So when you're using a minoxidil lotion or a solution or a foam, it's something that is topically applied on the scalp. And the pattern of usage varies whether you're a male or a female. For males, what we advise is usually twice a day application, once in the morning and once at night. And it has to be massaged evenly throughout the scalp. some people, just apply it on the area where they see the hair fall, but ideally it's supposed to be applied on the entire scalp. The reason being, you don't want to lose hair in the places where you're currently having hair because of the disease. So you need to apply it on the entire scalp. Whereas when it comes to women, we usually advise a single application at bedtime, and it has to be massaged in thoroughly. When it comes to oral minoxidil, there are some few checkups that we initially do before we prescribe that, and that is usually taken either as a single tablet or two tablets in a day.
Doctor, can these products be used without any uh, proper prescription or any expert help?
Well, so oral minoxidil definitely requires a workup before you use it, because there are certain side effects that you can experience because of that. One of them
Hmm.
being low blood pressure, right? So, and some people sort of have a little bit of cardiac side effects with that. So yeah, so that needs to be done under prescription basis only. Topical minoxidil also should ideally be done under the supervision of a doctor, right? So
Hmm.
that we can monitor and tell you how to apply it, and if we need to tweak it.
Right. Right. So, well, people who are wondering, and just because you have seen such products circulating in the market, or maybe your favorite influencers using such products, I think even if you're planning to use it, you should at least consult an expert,
Right, right,
whoever
definitely.
is close to you. I think that's the best possible thing. Even if you're willing to, I think you should consult, do it under an expert supervision, as doctor already mentioned. Moving ahead, doctor, let's talk a little bit about hair transplantation also, which is a major concern nowadays. How it can be done is, I've also heard a lot of people that if the maintenance is not proper, you can gradually lose all your hair, whatever you have gained. So, can we also clear the myths related to hair transplant?
Right. So hair transplantation, works by, like I said before, the pathogenesis of this hair fall is because of the DHT hormone, which is causing the shrinkage of the hair follicles. There are a
Mm.
subset of hair follicles in your scalp which are immune to this DHT, and the hair transplant typically exploits this hair follicles which are immune to this DHT hormone. So what we do is we extract the hair follicles which are resistant and immune to the DHT, which is typically from the back of the scalp, and we implant it in the balding patches or the areas where you don't have hair. Right. So because this is the resistant hair follicles, they are not going to undergo miniaturization in the future, and it's sort of a permanent thing. So there are different ways to do it. It can be done with the help of a strip of scalp that is extracted, which is called FUT, which is a strip method, or it can be done with individual hair follicles which are extracted, which is done with a technique called FUE. So those are the two main techniques that can be used. And yes, women can also get a hair transplant, and it does work for female pattern hair loss as well. And yeah, so coming to the other part, the transplanted hair being lost, right? So usually
Mhm.
with a good donor selection from the permanent safe zone, the transplanted hairs usually do not shed. What people do experience is the shedding of the normal hair which they have in the scalp, the surrounding hairs. Right, so those are the ones that typically go off even post the transplant. So for those, you need to maintain them with the PRP, GFC, and other injectables, and also solution like minoxidil and finasteride. And even for the transplanted hair, if you do undergo this procedure, what it does is it gives it an additional nutritional support, and it enhances the hair growth further. In fact, you can actually check out my Instagram page where I've given about hair transplant, and also I have a particular course on this suturing techniques, where people, if they're interested about medical students per se, if they want to learn about FUT and how to do it, they can check that out. Yeah, that being said, like for the most part, it is permanent when they do a hair transplant, provided it's selected properly and it is maintained.
Right. That says that you need to choose your expert wisely. Doctor,
Right.
we know a lot of salons nowadays. They offer a lot of treatments, wide range of treatments, whatever we get in the dermatologist, whatever get in the hospital, the salons are offering the same sort of treatments. So, how do we not fall for such trap? Or is it okay that one is getting such treatments, the skin treatments and the hair treatments in the salon?
I think it's definitely not okay, because you don't want to entrust something that's part of your body to a person who has not, studied the disease or the pathogenesis, or really understands what's going on there and why they're doing it, right? So it's better to go to a qualified professional, because they understand what's exactly happening. They know why they're doing it. They know exactly how to do it and how to manage any situation that happens while they're undergoing the treatment. Right, so I would definitely not advise getting such procedures done at a salon and not under a qualified doctor, because
Right.
they can actually harm you rather than doing good.
I totally agree on that. Now, speaking about the salon treatments that we're talking about, doctor, we know that there are professions which need such uh, glam look, where they need to, be they need to look in a certain way, I would say. uh, you said initially the heating and blow dry or whatever, that would not be the safest thing for your hair, but if not, then situation.
Right. So if at all you do work in a profession in which you need to undergo such heat styling procedures, right? So there are also safer alternatives available. Even within the styling world, there are different treatment options available. You have this keratin treatment, you have Botox, and Botox also is again divided into hot Botox and cold Botox. In fact, so Botox is a type of deep and conditioning treatment that sometimes does not use heat. So maybe you can opt for an option that doesn't damage your hair rather than going for one that damages your hair. So you need
Right.
to choose. And even if you are undergoing a keratin treatment or something that uses a lot of heat, ensure that your stylist uses a heat protectant spray so that it doesn't damage your cortex. There are a number of, even when you go for a stylist, there are a number of products that can help to protect your hair while they're doing it as well. So that also you can check out in my Instagram bio. So I have written about the various salon procedures, just so that you can be informed, and maybe you can ask your stylist when they're doing the procedure whether they're actually following those steps, and whether they're using those protective sprays and other solutions while doing the procedure.
Right. Well, that would be really, really very helpful. I think people after this live, we should definitely go and watch Doctor's Instagram channel so that we can get the most of the information that we are discussing about today. We are here for a very short period of time, and we definitely wouldn't be able to cover all the topics. So yeah, for all the informations, you can visit his channel. Moving ahead, Doctor, let's talk a little bit about alopecia areata.
Yeah, all right. So alopecia areata is an autoimmune condition. It's similar to thyroid disease, but it's against the hair. So what's happening here is your white blood cells, which are meant to protect and defend your body against infection, is going and attacking your hair follicles, and it's causing a hair loss. So that is the basic fundamental behind this alopecia areata. And what treatment we are doing is typically going to go and tame this overactive immune system to restore the natural balance.
Right. How do we manage this, Doctor?
Right. So the management typically consists of controlling the overactive immune system, which can be done with the help of corticosteroids typically. So which can be either in the form of injections, or it can be in the form of tablets, or it can be in the form of lotions. Along with this, we may add an adjuvant minoxidil just to promote the hair growth. In addition to that, there are a number of new therapies and small molecules available for helping the control the autoimmunity, such as your JAK inhibitors, like tofacitinib, baricitinib, which actually go and control this overactive immune system. And of course, there's the other modality of treatment, which I told as contact sensitization or contact immunotherapy, which works by distracting the immune cells so that they don't go and attack the hair, but instead cause a mild allergic reaction. So those are broadly the ways in which this alopecia areata is treated.
Right, right. Now, Doctor, well, I think when we're talking about hair loss, the major thing we miss on is the consistency that one needs to maintain. Uh, Maybe whatever treatments we are taking in, or maybe the lifestyle changes that we are trying to bring in, the consistency plays a very important role, and we tend to miss on that. How does one deal with that?
Right. So, majority of the therapies that I had discussed for, especially the pattern hair loss, are
Right,
required to be on a long-term basis, because the disease is chronic. And what we're actually doing is we're just putting a brake on the process. right? So we are
Mm,
not actually stopping the pathogenesis of the disease because it's entirely genetic, and we at the moment don't have any therapy that can work at a genetic level to cure it. So what we are, all the
mm,
therapies that we have right now are halting the disease progress, and you need to keep using them consistently so that the brakes remain applied. So
mm,
it is very easy to remain consistent, right? Just like you brush your teeth every day, just imagine applying this solution every day. So that would make it easier for you to apply it. And think of the benefits that you would have. You would have your hair again, and because of the having your hair again, you would get a confidence boost, and that in turn can help you in a number of ways. So I think that would give you the right motivation and to keep consistent with the process.
right. Doctor, tell us a little bit about a regular maintenance of healthy hair.
So the regular maintenance of healthy hair involves regular maintenance of a healthy scalp as well, right? So because the hair is arising from the scalp, so first thing you need to look at is your scalp health. If at all you face any
Mm,
itching, irritation, or redness in your scalp, you need to get that treated first. And you need to
mm,
at least shampoo, once or twice a week. If you have a lot of dandruff and buildup, you can use some shampoos which help to clear that up. Shampoos with ketoconazole, shampoos with salicylic acid. What they do is they help to remove the flakes and the debris that is there on the
right.
scalp. Yeah, so that in overall will reduce the amount of inflammation that is going on the scalp, and because the
Mm-hmm.
inflammation is reduced, the hair loss also will improve to a great extent. So then comes
Right.
to the hair. When you talk about the hair, so you want to use shampoos and agents that don't damage the hair but clean it to a certain extent, right? So most of the shampoos what we are using are typically aimed at cleansing the scalp. So although the
Mm,
hair also may be washed, you should typically target the scalp when you're doing your shampoo. And when you're
mm,
targeting your hair, you should focus on maintaining a regular conditioning for your hair shafts. Why is that so? Because the hair shaft has a coating called the cuticle, which gets damaged by your heat, environment, friction. So you want to restore that cuticle layer. So to restore that cuticle layer, you need to do a good amount of conditioning. So what I would suggest is, as a routine, wash your scalp with a good shampoo once or twice a week, and remember to condition your hair. And as an option, you can use serums to promote your hair growth. So that is something that you can do as a routine scalp basis, and do not routine hair care basis, and do not use soaps on your scalp, right? Because
mm,
the soap leaves scum on your hair, and that in turn may damage the quality of your hair.
right. Right. Well, speaking of soaps, there are shampoo bars which are available in the market nowadays, doctor. People widely use it. Do we recommend it?
Yeah, so shampoo bars are fine, as long as you choose the right type of shampoo for your scalp and your hair type, that should be all right.
Right. Do we also suggest, doctor, this is one of the biggest uh, question at today's time. We hear a lot of doctors nowadays saying that you should stop oiling your hair. But we never grew up like this. I mean, uh, since time immemorial, we have heard that oiling your hair is very important. You should regularly oil your hair. Still, in a lot of cultures, a lot of regions, oiling is one of the major part of a hair care routine. So what do we have to talk about that?
Yeah, oiling your hair is can be a good thing, especially because it coats the cuticle and prevents it from damage. The only thing you need to be wary about is how you oil your hair, right? So most people
Mm,
do an overnight oiling, or they leave the oil in the hair for a prolonged period of time. That is something you want to avoid, right? So you can do oiling maybe 1 to 2 hours prior to your wash. So that will give you a good
right.
amount of cleaning for your hair shafts. And also when you're oiling, just apply it on the hair shafts. Don't apply it on the scalp, right? So that is
Right.
something that you do to ensure that oiling doesn't damage your hair, but also nourishes and protects your hair shafts as well.
Wonderful. With that, doctor, I can see a few questions coming up from the viewers. The first question, the viewer asks, can PCOS cause hair thinning?
Right. So I talked about this pattern hair loss, right? So that occurs because of this male hormone, right? In women, this male hormone excess might be due to PCOS, or polycystic ovarian syndrome. And so what this PCOS does is it increases the amount of male hormone that is present in the blood. And what this male hormone does is it goes and it causes a thinning of the hair. So that is why it results in a pattern hair loss in female. So an answer to that, yes, PCOS can cause hair loss, especially the pattern type.
Right. So in that case, the patient first deals with the condition and then with the hair loss doctor, or they move simultaneously.
So usually, what we do is when a person comes to us with female pattern hair loss, we look to
Hmm.
evaluate where if there are other signs and symptoms that could suggest a PCOS, morphology or something to suggest PCOS in the patient, right? So sometimes they also
Hmm.
present with acne on their face. They may have seborrhea or excessive oil production, and their periods may be irregular. So all this provides us with pointers that the person may be having something more than just hair loss. And of course, we do an evaluation. We get certain blood tests done, and also we do an ultrasound of the abdomen to see if they have anything to suggest that. And if they do have PCOS, we usually treat the PCOS as well along with the hair. So we treat both of them because we want to treat the underlying cause as well, and not just to superficially treat the hair.
Right. Um, Also, can thyroid be one of the reason of our hair loss, doctor?
Yes, thyroid disease can lead to hair loss in the form of telogen effluvium. So what happens in telogen effluvium is your hair stays sleeping for a long period of time. The resting phase of the hair increases, and to such a great extent that it doesn't go into the growing phase. And because of this, you may have increased hair loss. So yes, thyroid can contribute to hair loss. So what we do is we often evaluate your thyroid as well when you present with this pattern of hair loss, and we do
Hmm.
correct your thyroid profile when you
Right.
present. Yeah.
Right. And I believe this is the last question for today's session. Comes from Sonia. Asks, which food help in hair growth?
Yeah, foods are like I said. I'll just reiterate it again. You need protein, you need vitamin C, you need omega 3 fatty acid, and you require few essential nutrients. There's no one go-to food that can give you all of this. You need to have a basket of things. For your omega 3 fatty acids, you can go for almonds and you can go for your pumpkin seeds. And for your other essential nutrients, you can eat green leafy vegetables. Chocolate is a good source of copper and zinc. So if you go for dark chocolate, that's quite a good thing. And as for protein is concerned, if you're a vegetarian, pulses, and you can eat a boiled egg if you consume non-veg or non-veg as well.
Right. Now, when we are talking about these elements in our food, doctor, what do we suggest? Take it from the natural source, or there are also medicines, there are also capsules available in the market. What do you suggest?
So there are capsules available in the market, and there are natural sources as well. So my recommendation would be if you can get it from a natural source, you can go for it. But most of our diet is usually deficient in these natural sources. In such cases, you
Hmm.
may have to do a supplement, especially because our diet is very poor in vitamin D. So sometimes you need to
Great.
take a vitamin D supplement, especially our Indian diet, because our food is not fortified as it is in the Western countries. So you may need to take a supplement because your diet may not give you the adequate amount that you require.
Right, right. Well, it was a wonderful, wonderful discussion with you, Doctor.
Thank you so much.
I think we needed a little bit more time, because there were so much things to learn from you. With that, I would like to conclude today's session, Doctor. Before we take a leave, any take-home message for our viewers who has watched us so far?
Yeah, take home message is your hair is important. You need to constantly care for it so that you enjoy your glowing locks. Stay consistent, and when you do face hair loss or have a hair problem, seek professional advice. Do not self diagnose and self treat, and do not go to unqualified professionals. Thank you so much for the wonderful opportunity.
Thank you so much, Doctor, for your valuable time. It has been a very informative session, as I already mentioned, and it was great to hear from you. We look forward to many more such session for our viewers in coming time. And I hope our viewers, after this session, you take a lot back. And even if you feel you haven't, you make sure you go and watch a doctor's channel. Moving ahead, I would also like to thank our viewers for today's active participation. For more information and updates, you know what to do. You have to subscribe to our channel, Radiance with You. You have to stay connected with us. You all take care and stay safe.